Now, I think that RxDiet is and Roman was a presenter actually at our conference. So Roman, are you ready to put your slides up and get started?
Absolutely.
Go ahead.
Thank you.
Hi, Roman.
Good afternoon. Thank you for having me. My name is Roman Kalista. I'm the co-founder and CEO of RxDiet. Let me pull up my slides. I'm happy to present this afternoon. So what is RxDiet? We recognized one of the biggest issues in our current healthcare, where about 10% of our most difficult patients cost about 63% of all costs, especially in the field of chronic conditions, type 2 diabetes, hypertension, etc. So what RxDiet does is that we help these organizations target this unengaged group of patients with medically tailored food and dietary guidance to help them with food insecurity and dietary training to improve these metabolic conditions. And the core features of RxDiet is that we use technology to deliver this service cost efficiently and deliver it anywhere. So our model is based on a concept that has been around for quite a while. This concept is called Food Farmacy, and it usually works the way where a physician would give a food voucher to their patient who is usually food insecure and suffers from unmanaged chronic condition or poorly controlled chronic condition. And this patient then can visit a local food pharmacy, where food pharmacy is somewhat like a grocery store where patients receive free food every single week, usually for about a year. And they also receive dietary guidance from a registered dietitian. And these programs have been wildly successful in terms of results. So you can see on my screen that over 2 points drop in hemoglobin A1C, for example, outperforming gold standard medication for these patients. Very importantly, saving over 80% of the healthcare costs for the patient. So you're maybe asking, if the concept is so successful, why don't we see it everywhere? Why isn't this concept broadly adopted by every hospital system and payer in the United States? And the problem is twofold. The main issues with this concept is that this is very expensive and difficult to start. So if a hospital wants to start a food pharmacy, they need to secure a supply chain for products. They need to staff the food pharmacy with full-time staff. And then the second problem is that this concept is not very scalable. So usually when you set up your one location, you can service about a 10-mile radius around that location. And you usually capture only a very small percentage of your very risky patients that you would eventually want to target. So with RxDiet, we decided to tackle this issue by providing scalability and cost efficiency to start the food pharmacy. So we work with every organization that is assuming risk for the patient. So it could be a payer, it could be at-risk provider, it could be self-insured employer. We work with retailers, national retail brands such as Walmart, Kroger, Fresh Direct, Amazon Fresh, and we're able to deliver food to over 90% of US zip codes. So we're able to reach almost every patient under these organizations, and we're able to provide this service cost efficiently. We're able to compute a meal plan using artificial intelligence, specifically deep reinforcement learning, and compute a meal plan out of ordinary grocery products and deliver these products to any patient in the United States, usually very cost efficiently, generally under $3 per meal. And we would then contract with the payer and or an at-risk organization and allow them to really start scaling efforts like a food pharmacy from a single patient to thousands of patients without any startup costs. So our product is very simple. We have our internal facing software on the left, which functions somewhat as our internal electronic health record. Our dietitian would talk to a patient and create what we would call a dietary prescription in our system. Our system takes in detailed information about this prescription, such as macronutrient, micronutrient information that we wish to prescribe to our patient. And then this prescription would be sent to the patient to their patient-facing app. So in this app, patients can further specify their preferences, their taste preferences, and then every week, very simply, order their grocery products and see their associated recipe set, see the recipes that they need to prepare any given week, so they can adhere to their therapy. We also offer an offline version for patients that are unable to use a smart device, where they can be part of the program fully offline. We of course needed to validate that our food pharmacy provided remotely works the same way as the actual physical food pharmacy. We've been able to acquire our own group of patients to run a private pilot study with these patients, and we're currently in the middle of that study, but so far we're seeing very promising results. We're seeing extremely high engagement from our patients. We're able to normalize blood sugar to a healthy range with about 80% of our patients within the first 2 weeks. And we're seeing phenomenal engagement and participation from our patients so far. We've been able to engage them in sports activities, and you can see patients are organically sharing a lot of food photography and engaging with the patient group and with the program. So our offer to the client is very simple. We ask the client to cover the cost of food, and RxDiet provides everything else. After we put, of course, our services at risk on top of the cost of food, and we then our plan is to work with the provider, the at-risk provider, or the payer to share the savings per patient. So we support the patient with the grocery deliveries. We support them with a personalized meal plan. We support them with dietary and health lifestyle coaching, and also we kind of approach the patient holistically. So we sometimes help them with their disability checks. We help them with housing. We help them with any other social determinants of health that they might be currently dealing with. To compare RxDiet to other alternatives currently available to payers and risk-bearing organizations, if I compare RxDiet to a local food pharmacy, for example, as I've mentioned, the startup costs are extremely high. Usually RxDiet doesn't cost anything to start with, and the scalability is very poor of a local food pharmacy. We currently have national coverage. And we're able to service almost any patient in the payer network. If we compare RxDiet to ready-made meal delivery, the cost per single meal is usually very high. As I mentioned, RxDiet meals usually arrive to patient door at below $3 per meal. And also, we're trying to achieve long-term behavioral change and long-term change in patient habits. So, which we don't usually achieve with ready-made meals. With RxDiet, we train our patients to learn how to shop for healthy products themselves, and how to create a long-lasting habits of cooking and preparing their own food. I'd love to show you a short product demo. So this first part of the demo shows you the internal facing software where we are setting up a patient's dietary prescription. So our dietitian would be at this point on the phone with the patient, and she would be putting in basic information about the patient. In this case, we're dealing with end-stage renal disease patients. So we have the actual weight, we have dry weight, and then we're setting up comorbidities of type 1 diabetes and end-stage renal disease on patients on hemodialysis. We can exclude ingredients for the patient, specify allergies. And here on the right, you can see that the system already has specific dietary guidelines built into it. So immediately takes potassium, phosphorus, and sodium into consideration for our end-stage renal disease patient. We then can specify dietary types on existing evidence-based diets. And the dietitian can further, of course, alter the macro and micronutrient prescription. We can then add additional micronutrient targets such as calcium, vitamin D for end-stage renal disease patient, for bone density, and can save our prescription very easily. Then the system shows our staff a very brief summary of the diet that we're prescribing to the patient. And simply by pressing one button, our staff can send this dietary prescription to the patient. Patient then receives this prescription as a code, and they can simply log in to our app and go through the initial onboarding process. They're still on the phone with our dietitian, so our dietitian will guide them through this process. We allow them to add additional household members to eat with them. So we support the entire family with this program. So entire family receives enough food to prepare these meals, because we know it's near to impossible to influence our patient's diet if they're the only ones in the household trying to adhere to a dietary change. We further specify household allergies, kitchen appliances, and additional ingredients that we might want to exclude based on taste preferences. And then we go through this section called taste profiling. We ask the patient to like and dislike specific meal options. And based on this rating, we built a taste profile in the background where we analyze each meal by up to 130 data points. And we're able to build this robust taste profile, and we then serve meals to the patient based on this taste profile. And we, of course, alter this taste profile after each recipe that the patient cooks, and it gives us rating for that recipe. So every week we improve on last week's ratings. In the last step, we ask the patient for their delivery address, and this helps us connect to their local store. And at this point, we're able to look in that given store. We're able to see the current product availability. We're able to see the prices, nutritional information, and our artificial intelligence goes to work and starts computing the program. It solves a very complex mathematical problem where it combines the ingredients into this wholesome meal plan that fits the patient nutritionally, also is optimized for cost and for a patient's taste profile. After we're done with our computation, we still offer several menu options to the patient. They can always pick one and select delivery time slot and check out, usually with their code from their provider that covers their meals. After that, patients see their recipes every single week. They can order their groceries by pressing one button. And at the end of the week, after they're done cooking, they can order the next set of ingredients for the next week. And they can follow this process throughout the entire program and adhere to their treatment. This is our management team. I don't think we're diverse group of guys with backgrounds in medicine, software development, payers, and data science. Our advisors, just a couple of featured advisors. Michael Danzinger, a leading expert in diabetes reversal, has recently joined us. Steve Logan has recently joined us, acting as a market president for Aetna for the past decade, I believe. And just to mention a few last things, RxDiet is currently raising our seed round. We're also in discussions with several prominent managed care organizations in the US, and please feel free to reach out to me on my email, on my LinkedIn, or in person next week at the health conference. And I'm happy to answer any questions.
Thanks, Roman. That's terrific.
Thank you.
And you got a little feedback yesterday also, but maybe I'll kick it off a bit. And Adrian, how much time do we have? I'm sorry.
Have about 5 minutes per
Okay.
for each one.
Dennis, we're running a little behind, but we should give folks a little time. So take a couple minutes. Go ahead, please.
Sure. Roman, and maybe it's too early, but I couldn't quite figure out how you were going to make money on this. Are you going at risk and trying to share in some savings with the payers, or are you trying to make money, or are you trying to make money on the per meal cost or per meal charge?
Absolutely. I'll give you an example. So we're dealing with a complex patient that costs $100,000 per year. We enroll them in our program, and we drop the costs first year to $40,000, let's say. So we would split or share a part of the $60,000 cost savings, while the payer pays the cost of food for the year, and we put our services at risk for the year.
Yeah, but how about if that drop is due to something else other than RxDiet?
Of course, yeah. So it is the endless discussion through value-based deals about attribution. Of course, so these deals are not simple by any means, but we believe they're doable.
Mm-hmm. And what do you expect, or what have you found out about adherence to the program? We talked yesterday about food being fun. Is the patient journey here fun, or do you have any sense of what adherence might look like?
I believe for our patients, at least, it's very much fun. We've seen historically about 60 to 80% adherence through these programs, and that is simply due to the fact that patients in these groups joining these programs are usually food insecure with very low disposable income, and the promise of free food alone is something that keeps them in the program, and they are willing to kind of participate in the associated activities just due to that. And our persistence in the program is currently at 90%, but we've been running our study for about 6 weeks now.
Right, and what about patients that aren't digitally literate?
Yeah. So
which might be kind of your population.
That's a great point. That's a great point. And but surprisingly, especially during COVID, we've seen great uptick in technical literacy. We have patients in the program that are from Medicare Advantage plans, that are from dual plans, and we have patients that are 72 years old, and they're operating the app actually. But we do offer the offline version as well, so we're able to supply the patient with recipes and instructions fully offline, and communicate through telephone other than Zoom calls. So this works perfectly well offline as well.
Right. And some studies have shown that people regain that weight after a while. So if the patient goes from 100,000 cost to 40,000, and then goes back up to 80,000, maybe these are details that need to be worked out. But what do you think about that in terms of patients regaining?
Yeah, absolutely. That's a reality of life. And I don't have data from our program to demonstrate that this does not happen. But
right.
What we're trying to do is achieve long-term behavioral
right.
change. And our patients, I believe that they will sustain the healthy habits, of course, and we allow them to retain the patient group forever. So it's not something that we finish one day and they don't have access. So they'll still have access to other patients in the group, to the resources, and hopefully they keep interacting with each other and supporting each other throughout the years.
Great. And last thing, I know we're running a little late. Rom, as you think about 5 years from now, and this all works, how many patients, how many people do you think you might have as customers?
And I'll tell you exactly, it's 3 million customers that we're hoping for. That's our segment in of patients specifically enrolled in Medicaid that we believe fit our profile perfectly, and that's our initial target group.
Great idea. Good luck on the execution. Good luck on the seed round. It's great to be with you the last 2 days.
Thank you, Dennis.
Thanks,
Very
Ron.
appreciate
Thanks,
very
Ron.
much appreciate the opportunity.
Yeah,
Thank you,
anything I
everyone.
can do to anything I can do to help, just let me know.
Thank you.